Okay, so Aphrodite has gone, so you've just got me now, I'm afraid. So some of the things we've been looking at are data surveillance, looking at promising interventions, health needs assessment, education, research and PPI. So I'll just talk about some of the things we've been doing from that. So the activity on physical activity is actually very flaky. So there is a National Health Survey for England which collects good data and does accelerometry, but it's only done at a national level, and you can't really translate it down to Bristol, and you certainly can't look at trends over time. Then there are various other bits of data, but most of them are, you have to extrapolate to local data, so it's quite hard to know how you're doing. There is a little bit of data that Sustrans have delivered across 10 different cities, funded by the City Council, so we've pulled that out. And this is about cycling data. So Bristol, as you know, has undergone a real renaissance in cycling over the last 10 years. Numbers have really almost doubled of people cycling to work, cycling around the city. But as you can see, it hasn't really got through to the older population, so it's got a bit stuck. Once you get past 65, you're not terribly likely to be cycling in this city. And that's probably some of the reasons that Marcus so graphically described earlier on. Sharing a road with a freight truck is not very appealing. We've got a great charity here, Life Cycle, who've been doing a lot of work with over 55 cycle training, getting people back into cycling, which is completely oversubscribed and overwhelmed. So I think that's an area that we might want to be looking at, particularly around e-bikes. We have got, does everyone know about the Bristol Quality of Life survey? This is an ongoing survey that Bristol City Council does every year, and it has various questions about physical activity. So we have looked at in detail some of this data. So this is self-reported data about how often people exercise 5 times a week, which is the current physical activity guidelines. And as you can see, it starts off about 40% and it tails down quite rapidly with age. What I would say is we know is that people are always over-report what they do themselves. So the figures are actually much less likely to be this. So this is one really straightforward, thing that people could be doing that they're not doing that could have a really big impact on their health. We're interested in looking at new technology. Anyone got a Fitbit here? No? Okay. Well, I've met so many people recently who've got Fitbits and who are kind of obsessionally, even worse than a phone, they're continually looking to see how many steps they've done. So I think there's something we might be able to do about collecting some of that data. One of the things that's been really exciting is that a project we were involved in that was funded by the MRC called Active, Connected and Engaged Communities, which was about using peer activators, volunteers, to get older people out and about and active, which is really successful. We work very closely with Link Age charity in Bristol, and they've just got a big grant working again to extend this project over the whole north circuit of the city. So that's very exciting. They've slightly changed the title of it, but this is the recruitment poster. We've also got a big research grant from the NHR, Retirement into Action, which again is about a structured physical activity programme for people who are kind of on the cusp of starting the slide down to losing their mobility. So we're busy trying to recruit for that. That's modelled on a big project from the States. We've also got some grant funding from Bristol Ageing Better, which is a big lottery funded project running in the city to help the delivery, because as Aphrodite said earlier, the NHR, you get research costs, but you don't get any intervention costs because the local authorities or whoever's meant to be delivering it has to provide that, which can make it quite difficult to do some of these studies. I think our feeling is that being branded as a hit, and for a lot of grants now you have to demonstrate how you're linked to the community, how you're going to implement. So it's been really helpful, really valuable. That's the structure of the programme, I don't need to go into that. We're involved as a partner or a named support for a grant that South Gloucester got from Health Education England Innovation Fund about evaluating a project they're doing about trying to identify people who are pre-diabetic, potentially at risk of getting diabetes, and helping them change their diet and lifestyle. And again, I think it just helped strengthen the application, made it look more, perhaps just made it clear that it was part of a programme of work. So in terms of what's gone well, the research funding was clearly good. Moving on the implementing the ACE project, I think we've pleased with some of the links we've got with the third sector. We're really delighted to have Jan back as project manager. We finally, after a bit of struggling, identified who the CCG self-care lead was, and that's been very positive. So we also contributed to Marcus's bit of work on the Spatial Plan, and I think we were able to put in some useful evidence and raise the profile of localities and how important localities are. There's a lot of interest in employment, but of course a lot of the population actually aren't working at any one time. We put in our position statement about 20-mile-an-hour zones, and we made sure there were some nominations to the Evening Post Awards, which was David talked to earlier. I think it has been quite a struggle to work out who to talk to about implementing, and I think the talk from the commissioners just showed there's that kind of area where is it prevention and public health, or is it self-care and the CCG? And I think there's a real danger that some of these things that have a real potential to make a difference fall between the two stools. And I'm not sure we've quite worked out how to involve. We've had a few people who are interested in being involved. They've come to our meetings, and I'm not sure, I feel we should be doing something slightly more proactive, and it may be that the sort of immunisation model panel is better. So I hope this year we'll strengthen our links to public health and the CCG. I think it'll be interesting to see how the STPs pan out. We want to look about surveillance data, and I think we're probably going to try and develop something about e-bikes and older people, and probably there's been some really interesting work going on in all the universities in the city about older people and primary care, exercise, bikes. So we're probably going to pull all that together into a conference. Okay.
Great, thank you.